Hello viewers, welcome to our channel Mai. After a big break, I think we took a really big break for festival. Sorry about that. Today's topic of discussion is cervical cancer vaccine. I get a lot of queries about cervical cancer vaccine from my patients like, Doctor, what is the cervical cancer vaccine? Should I take it? Should I give it to my daughter? What are the side effects? My daughter is not even sexually active. Should she really need it? So on and so forth. So today we'll answer all these questions. First question is, what is cervical cancer vaccine? It's a vaccine for HPV virus. HPV virus are a group of virus which are transmitted sexually and they can cause cervical cancer, vaginal cancer, vulval cancer, oropharyngeal cancer and all these warts. So what does this vaccine do? This vaccine will give us immunity against this virus. So even if we get infected with this virus also, this virus cannot cause the havoc which they cause when they infect us when we have no immunity. So the next question is, who can take this cervical cancer vaccine? All women between the ages of 9 to 45 years can take this cervical cancer vaccine. The children between 9 years to 15 years, they require only 2 doses 6 months apart, and the women between 15 years to 45 years, they require 3 doses. The first dose is called 0 dose, and after 2 months they will take the second dose, and after 6 months they will take the third dose. So this vaccine is very effective when it is given before the person starts their sexual activity, because all said and done, it will give us immunity before we get infected with HPV virus, and once we start our sexual activity, we get infected with HPV virus. So once we start our sexual activity, shouldn't we take the cervical cancer vaccine? Is it not effective at all? No, it is still effective, because once we start a sexual activity, not necessarily we get infected with all the strains of HPV virus. And this cervical cancer vaccine has many strains of, it gives us immunity against many strains of cervical, this HPV virus. So that's why even if we take the vaccine after we start our sexual activity also, it will still protect us against this cervical cancer and all the other genital cancer. So now that we know that the cervical cancer vaccine is very effective for us, is there any people who should not take the cervical cancer vaccine? Yes. Cervical cancer vaccine is not recommended for pregnant women. So you should not take the vaccine when you're pregnant. However, once you deliver, even though you're breastfeeding the child, you can still take the cervical cancer vaccine. I typically give all my postpartum patients, once I deliver them, I typically advise cervical cancer vaccine to them. I take it as an opportunity to immunize them against this cervical cancer. Then what are the side effects of this vaccine? Usually this vaccine doesn't have many side effects. It can cause some kind of soreness in the site of injection, but some people do complain of vomiting sensation and fainting. That's why once you take the vaccine, you have to rest in the same place for about 15-20 minutes, and then once you feel fine, you can walk out of your doctor's consultation room. Then now that we have got immunized against this cervical cancer vaccine, should we still screen ourselves for cervical cancer? Absolutely yes. All sexually active women should get the screening done for cervical cancer once in 3 years with pap smear test. So doctor, what is this pap smear test? It's a screening test for cervical cancer, and I'll come out with another video about the pap smear test. So I think I have told you in detail about the cervical cancer vaccine, and if you have any questions, please put in the comments below. I'll be glad to answer them. Thank you and bye for now.